Welcome to the Institute of Global Perioperative Care podcasts, where we explore the people, partnerships, and systems working to strengthen surgical and perioperative care around the world. I'm John B. Sampson, and today we're taking a closer look at one of the most important issues in global health system strengthening, which is the training of the surgical and anesthesia workforce. Across many low and middle-income countries, access to safe surgery depends not only on infrastructure and equipment, but also on the availability of well-trained surgeons, anesthesiologists, and perioperative teams. In places like the Democratic Republic of Congo, where healthcare delivery faces enormous geographic and resource challenges, which are largely a result of political instability, building that workforce is essential to improving outcomes and expanding access to life-saving care. Today, I'm joined by Dr. Neil Wetsig, President of the Permanent Council of the G4 Alliance, to discuss surgical and anesthesia training in the Democratic Republic of Congo, the challenges and opportunities in workforce development, and the important role of the College of Surgeons of East, Central, and Southern Africa, also known as COSECSA, in expanding surgical education and strengthening regional training systems across Africa. This conversation is about more than training programs. It's about building sustainable systems, strengthening institutions, and developing the workforce needed to deliver safe surgical and anesthesia care for generations to come. Thank you for joining us. Let's get started.
I've had to relocate back to Australia. In fact, we'd gone back to Australia for what we thought was a 6-week visit to see family, and we've been unable to return to Congo since then. But as you say, the other role I have is the president of the G4 Alliance, the Global Alliance for Surgical Obstetric Trauma and Anesthesia Care. I took up that role as president of the Permanent Council at the end of 2024 for a 2-year period. I've been on the executive for a few years now, and that also means I'm part of the board of the G4 Alliance.
Do you still practice any in Australia, or is all of your work now global health work?
All of my health work is now global health work. I finished that practice 10 years ago, although during COVID I did do some locums to try and sort out a few problems for the local health service, but apart from that, yes, I'm practicing mainly in Africa now, well, completely in Africa.
And the hospital in Congo does anesthesia training as well as obstetric training?
Yeah, we have one physician anaesthetist who we have an Australian not-for-profit charity that supports the work, and so our not-for-profit charity, OzHeal, actually supported the training of the first physician anaesthetist in the region, and up until recently he was the only one for 10 million people. There's about 3 or 4 now, but he supervises our anaesthetic nursing program, so we have 8 anaesthetic nurses at the hospital who are well trained. We participate in the anaesthetic nursing program that happens through GOMA, and we have one physician anaesthetist who supervises them, and we're currently funding a second physician anaesthetist who's training in Tanzania.
Okay, all right. Is it or is the training you're doing residency level training, or is it for people who are after residency? What is the?
Yeah, the surgical training is for postgraduate training with COSECSA, for fellowship of COSECSA. The anaesthetic training is for anaesthetic nurses, but as I say, the physician anaesthetist, because there's no training program in Congo, we have to send them away, and they've trained in Tanzania at Muhimbili University in Tanzania.
I see. So there's no physician anesthesia training in
No.
Congo, right?
In fact, until we started the surgical training program, there was no surgical training program in all of Congo. That's improving since then, but that was why we started that
And the
first program.
23 rebels, they still have control of the area where your hospital is?
Yeah, sadly.
Mhm.
And that's...
Is the hospital still running?
the hospital's still running. They managed to... it's not widely known, but there were about 10,000 people killed in the first week of the invasion in late January, early February last year, 2025. The hospital took in over 1,000 casualties for a 300-bed hospital. It was overwhelming them, but they managed to do that. There's been all sorts of issues during that time. The hospital, thankfully, all of the hospital staff were safe. They've had many other friends and relatives who've suffered, and we did have one of our ambulances that was shot up, and one of the ambulance drivers was wounded badly, but he survived. But the hospitals continued to run, and the purpose of the hospital is it provides healthcare to all anybody that comes through the door, so to speak. And so we end up with both ends of the combatants being treated within the same hospital, which I've been involved with for a number of years, which is always a bit tricky, keeping people separated in different wards and things. But that's the way
That
we
must
work.
be a large financial burden. How do you guys manage with financial resources to support so much free care?
It's been a huge burden up until this event. The hospital ran with about 50% of patients were private or paying customers, and 50% were those that were unable to pay. The difficulty with the conflict is that many of the people that were able to pay have actually fled either the region or the country, and so the income of the hospital has diminished considerably. Staff salaries made a decision to, rather than put staff off, to actually reduce salaries. So they reduced salaries, which has put extra burden on the staff, and they've continued to work in a fantastic manner, considering that the banks in Goma are still closed, so getting money and supporting their families has been very difficult. So it's an ongoing thing that we hope will be resolved in due course. But this is the amazing part, is that I was supervising a lot of the programs, but because I haven't been able to be there, our Congolese colleagues have stepped up and continued all our training programs, which I'm really proud of them of. So we do a basic trauma course, and our emergency physician and physician anaesthetist and the two or three young surgeons have continued all that training and continued the surgical training with COSECSA, to the point that two of our trainees who sat their exams at the end of 2025 actually passed their exams. So considering the distress they've been under, that's a fairly fantastic situation. COSECSA was formed in 1999, and it's predominantly to train surgeons to a full surgical standard. So trainees do 5 years of training. They do 2 years of basic training and then sit a membership exam, which is a multiple choice and oral exam. And then if they pass that, they go on to further 3 years of specialty training to train predominantly general surgeons. There's been over 500 surgeons in Africa trained, sub-Saharan Africa trained, since the institution of the college. It's in 14 separate countries, and there's 3 associated countries, one of which is Congo. So it's a very important institution in sub-Saharan Africa, improving surgical capacity considerably. It's now branched into, over the past 10 years, branched into subspecialty training. So there's training programs in plastic surgery, pediatric surgery, neurosurgery, orthopedic surgery, pediatric orthopedic surgery, otolaryngology. So it's really quite a sophisticated training program producing high quality surgeons.
That's good. And so it serves as a major certifying institution to certify a college to certify the qualifications of postgraduate surgeons. But
Yes.
some of the countries probably rely entirely on COSECSA, and while other countries may also have their own national certification for postgraduate surgeons.
Yeah, that's correct. The traditional training of surgeons, anaesthetists, has been through universities, so they gain a Masters of Medicine in surgery or in anesthesia at some of the larger universities, and that's been the traditional training in sub-Saharan Africa. So COSECSA is based more on a competency-based and practical fellowship training, and so that's recognised by many of the actual ministries of health in the different sub-Saharan African countries now. It's been a challenge in Congo because COSECSA was a new program. They recognised training through universities which had not really had a surgical training program in the east. So where I'm located in Goma is the east. It's quite a different situation to that in Kinshasa, the capital in the west. And so in the east there'd been never any training, and since we started the COSECSA program, the University of Goma, for example, has started a postgraduate training program. However, I get to witness both programs, and clearly the COSECSA program, I think, prepares a much more highly qualified surgeon.
Thank you for joining us for this episode of the Institute of Global Perioperative Care podcast. And a special thank you to Dr. Neil Wetsig, President of the Permanent Council of the G4 Alliance, for sharing his insights on the realities, challenges, and opportunities surrounding surgical and anesthesia training in the DRC and across the region. Today's conversation reminds us that strengthening surgical systems is fundamentally about strengthening people. Investing in training, mentorship, institutions, and long-term workforce development. Sustainable access to safe surgery and anesthesia cannot exist without a skilled perioperative workforce. The work of COSECSA and its partners demonstrates what is possible when regional collaboration, education, and systems thinking come together to build lasting healthcare capacity. At the Institute of Global Perioperative Care, we remain committed to advancing these conversations and supporting the partnerships that move global perioperative care forward. If you found this episode valuable, please subscribe, share it with your colleagues, and continue the conversation on how we can collectively strengthen surgical, anesthesia, and critical care systems around the world. I'm John B. Sampson. Thank you for listening, and we look forward to having you join us for our next episode.